Hello, my name is Andrea Baskin. I am the Clinical Director for Safe Landing Recovery. In my last video, I talked about signs that your team might be using. So in this video, I want to talk about what to do if you find out that your team is using. So first off, the first thing I recommend is after you find out that your team is using is sit down, take a deep breath. This is a lot of information to take in, and the thought of your team using might be terrifying. There could be emotions of anger, guilt, sadness, worry that come up. Let yourself feel. All those are valid emotions, and this is a very difficult thing. So let yourself feel. Try to talk to someone you know, if it's maybe another parent or somebody that you really, really trust. Let them know that this is going on. Try to get it out. It will be important just to talk to someone about it. If you have a therapist, even better, talk to your therapist about it. After that, I would recommend having a plan of action. In that plan of action, I would recommend for you to talk to your team. Part of talking to your team might be showing them some of the evidence that you found out. The conversation could be something like, hey, I just realized that this might be something that you're doing. I have a lot of concerns about it. Can we talk a little bit more about this? You might be surprised that some of these teams could be very honest about what they're using. If you find out that your team is honest, then we can go on to the next step. At that moment, if your team says, I deny it, it's not mine, I'm not using, that's a lie, you're accusing me of something I haven't done, at that moment, I would maybe have a drug test readily available to do. You can buy a drug test at any pharmacy, Walgreens, CVS, even I think Publix has them. You can purchase it anywhere. I would have it ready, and at that moment, I would want my team to perform the drug test that will show you the most common drugs. I would get a 12-panel cup. This will show you the most common used drugs, and they will show positive or negative. At that moment, you won't really know how much they're using, but if they are using, then that might be something that needs to be addressed. Second thing I would do is make an appointment with an outpatient therapist. If you don't already have an outpatient therapist you have worked with in the past, there's several places where you can look. Google and Psychology Today has a listing of all the available therapists around your area with, what insurance they take, how much they charge. I would suggest, calling around, using your insurance if you can, or if you need to pay out of pocket, finding someone that is specializes in adolescents and also who specializes in substance abuse. The reason for that would be they would be able to guide you to what's next. At the moment that they could work with you and your team, and at the same time they could create a plan if things don't get better. So other options in my next video, I will talk about other options of treatment. So if outpatient therapy is something that is not working, I would suggest trying it out first. But if it's something that is not working, I would recommend higher levels of care. So in my next video, I will talk about different levels of care and how to know what level of care your child should be in. Thank you.